And I'm going to introduce to you Ms. Robin Jackson. Robin's pronouns are she, her, and hers. She is the Policy and Systems Advocacy Coordinator for the Mississippi Coalition Against Domestic Violence. She's a native of Jackson, Mississippi. Robin began her journey as a women's issue advocate while competing in the National Scholarship Service pageants. She has advocated for women reproductive issues, educating funding, equal pay, and voting accessibility, while coordinating advocacy for issues facing domestic violence victims and service providers. Robin also enjoys creating strategies for program projects and issue campaigns. Robin's mission is to create avenues for change through storytelling and testimonials of advocates, supporters, and survivors. And I want to introduce you all to Ms. Robin Jackson.
Well, hello, everybody. Super excited to get ready to dive into such an interesting topic about engaging survivors and grassroots organizations in policy advocacy. Just want to thank AJ for that awesome introduction. But I'm going to give a little introduction just to let you know a little bit about how this is going to go. So I am a girl born and raised in Mississippi. I had a father who lived in Louisiana for most of his life. So today you might get a little Southern slang. We're going to try to hold that back. But you also may get some Cajun tendencies as well. So that is going to make this very exciting. I'm also very animated. So you may see my hands going like this. You may also see me putting and diving into some deep topics and putting some emphasis on some information and things. So I'm excited. I hope you all are ready to talk back to me because I am a person who would love to hear and to guide this conversation. But I'm just one person. We understand that this work can have different lenses from different people. So this is going to be an engaging conversation. Next slide. Okay, so in this session, we are going to discuss the definition of advocacy. One thing that we have learned in this work is that there are so many different ways that people see advocacy. We're also going to talk about 3 particular forms of advocacy. There are many forms of advocacy, but as it relates to engaging survivors and grassroots organizations, there are 3 forms that we want to dive into today. We're also going to look at the importance of community mapping and creating landscape analysis. That's going to be my favorite part today. So I'm just going to let you know I'm going to be moving and jiving during that. At the end, we will discuss the impact of storytelling and strategic advocacy. Next slide. So, what is advocacy? I have been doing this advocacy work, as AJ said, for possibly about 7 years. And I will say that through this 7-year process, I have learned to engage with different forms of advocacy, also to look at different definitions of advocacy. Our guiding quote for this segment is, "No voice is too soft when that voice speaks for others." So when we're thinking about advocacy, one of the things that we hear all the time is, that's just not my thing. You know, I'm not the person to talk to people. I'm not the person to kind of advocate, but we can, because no voice is too soft when that voice is speaking up for others, okay? So let's dive into what is advocacy. Next slide. So, advocacy is the act of supporting or bringing awareness to a certain cause or issue. This looks like various different things. Certain forms of advocacy are issue advocacy, systems advocacy, and policy advocacy. So when we think about when we think about issues advocacy, we're thinking about a singular one cause advocacy. So if we were looking for an example of that, that would be a single issue such as education, housing, Medicaid. All of those are single issues that that we can advocate for in policy and in also systems. So when we're advocating inside of the system, systems advocacy is a twofold advocacy. So it's the system that is causing or affecting the direct service or resource for that action. So when we're looking at systems advocacy, we're thinking about the education system. We're thinking about the healthcare system, and also looking at things like the criminal justice system. So system advocacy is the overarching when we are wanting to advocate within a particular system. Now, getting into what I love the best, which is policy advocacy, I like to think of policy advocacy as the big picture. The big picture is it's affecting several different entities, several different disciplines, and several different communities, and several different systems. So when we're looking at policy advocacy, we'll see things like the American Rescue Plan, which was given to families during the particular times of COVID to be able to help families that were, having housing issues, companies, businesses, and all of those things. So that was a form of policy advocacy. We also look at things like the VOCA fix, being able to fix the amount of funding that helps to provide resources to programs so that they can help survivors and victims, okay? So just going over that again, that's issue advocacy, systems advocacy, and policy advocacy, okay? Next slide. So one of the biggest things that we love to talk about when we're doing advocacy, because most of our organizations are 501c3 nonprofit organizations. And as many people say there's a thin line between love and hate. Well, there is a thin line between advocacy and lobbying. And so I always like to bring this principle in so that we, as advocates and as people who are orchestrating survivors and grassroots organizations and policy advocacy, to know what that thin line looks like, okay? Advocacy is the act of promoting your opinion or providing education on a particular case or policy. Lobbying is a little bit different. Lobbying is the direct influence of legislation and urging policymakers to vote for or against a particular policy. So that looks like, let's say we are wanting to provide an advocate confidentiality law for victims and advocates, okay? So our advocacy would be to educate legislators about the importance of the confidentiality between an advocate and a victim, and the importance of being able to ensure a victim that the conversations that they are having with that advocate are confidential. That provides a safety net for our victims when they are coming into our programs. Well, lobbying would be a little different. If there is a particular piece of legislation that is outlined for advocate confidentiality, and let's just say it's HB 695, lobbying would be asking that particular legislator to vote yes or no on that direct piece of legislation. So our job as advocates are to educate and to bring awareness about the particular reasons and why a particular legislator or legislating body should or should not consider a piece of legislation, okay? So one thing that I like to always put in here is that federal funding guidelines prohibit spending on lobbying and legislative influence. So if you're like me and you work for a coalition, it is prohibited that we use our federal funding in order to lobby. But one of the great things that we can do is that we can provide advocacy, which is that education awareness piece for consideration on how particular policies affect victims, survivors, and also the services that we're providing. Next slide. So now that we got that out the way, we know what advocacy is. We know the 3 different forms of advocacy: issue advocacy, systems advocacy, and policy advocacy. We understand the thin line between love and hate, as I would say, but the thin line between advocacy and lobbying. Now we get into the good stuff. And I told y'all in the beginning that the community mapping and landscape analysis portion is my favorite because that's what makes this a strategy session. Now we're about to get into the strategies of engaging survivors and grassroots organizations in policy advocacy. Our guiding principle today is alone we can do so little, but together we can do so much. And that is one of the biggest things when we're wanting to engage survivors and grassroots organizations in this work is to understand how impactful a large body is when we're wanting to go into a particular area and make noise about advocacy and why a particular piece of legislation or policy would be impactful for the work that we do. Next slide. So, the first thing about community mapping and landscape analysis is knowing who's on the ground. If we are unaware of where we're going, what we're doing, and how we're going to get there, who are the people that we're going to contact, and all those particular things, it's kind of like working backwards. So one of the great things about this work and what we've done here at the Coalition is we do community mapping. And so community mapping looks like breaking down who's who are the key players, who are the people that we need to contact? Who are the people that support us? Who are the people that oppose us? And being able to have a better understanding of those things. So think about community mapping as driving a vehicle, okay? So when we're thinking about organizations, the organizers of this particular policy advocacy initiative, we know that organizations are the vehicle. So they are the ones that are helping drive advocacy strategies through various communities. Here at the Coalition, we like to engage various different organizations that may not all be organizations that we would always look to. So we're not looking at organizations that provide the same services as us. We're not always looking at the same organizations who provide to the same populations that we do, but we are looking at people that are serving various populations, that are doing various forms of work because they are inside of various communities. And so one thing about policy advocacy is when you have multiple people that are coming together and speaking the facts about a particular cause, it makes it easier to make noise about why a particular policy is important to the particular work that we do. So we're in the vehicle, we have our organizations, okay? So when you think about that, one thing that we don't talk about a lot when engaging survivors and organizations is the organization of businesses. We just talked about that, federal funds do not particularly give us the attribute to use the money to lobby and to do advocacy work. So we need help. We need help for funding. And I say that because a lot of people don't think about the fact that like infographics and grassroots organizing on the grounds, it takes money. You have to pay canvassers to go and knock on doors so that people are aware about the policies that are going to affect those in their community. So you have to have an engaging or a fueling system. This is the gas we're talking about when we're wanting to engage survivors in grassroots organizations. So our businesses are our fuel. They're the ones that are helping us to provide financial resources and donations to this policy work, okay? So we're in the car. We have the organizations from various different communities that are helping us drive this policy advocacy. We got gas. We have some finances going on. There are some people that are helping us fund this and giving us the push that we need. But we also need to make sure that people know we're coming. So when we're looking at engaging survivors and grassroots organizations, we need to know our legislative key players. Who are the people, where are the voices that make the noise for us before people can even see us? And I like to call this like the horn. Like if you're coming and somebody's about to back out and you're like, hold on, wait a minute, don't back out. You can't see me, but here I am. So you blow the horn, beep, beep, here they come. Legislative key players are the people who go into the legislative body and tell people, well, hey, this organization or this group of a coalition or this group of organizations are coming and they are concerned about a particular cause or a particular policy. And so what happens is when the vehicle, which is the organization, and those businesses, which is the field, get into a place of doing advocacy, there has already been some noise made to let these people know, hey, here they come. They're about to give us some information. They're about to give us some education, and we're about to see why this particular policy is important to those that are on the ground. Okay, next slide. So when bringing all of those people, we have our vehicle, we got our gas, we blew the horn, we told the legislative key players, here we come, it's time to move, it's time to, get everybody on one accord to let them know that we have arrived. The Policy Advocacy Initiative has arrived. But one of the things that we don't do often, and I've seen this here in Mississippi, is we don't bring survivors to the table. See, survivors are they're the visual. They provide tangible references that magnify the effects of policy changes on real people. Think about going to a legislator and explaining to them, or having a survivor explain the story to them that resonates with their heart and their mind. Thinking about, wow, that could have been my daughter, or that could have been my church member that engaged or had that particular situation to happen. So when you're thinking about a survivor in this vehicle, there are mirrors. They're the things that we are showing to give people the reflection of how a particular policy did or did not help a survivor, but also to give us a front mirror, a front view, to see that if we are continuing to move this policy, how could this be helpful to provide better resources, better services, and to provide more funding to service providers as they're moving forward to create a better way of life for victims and survivors, okay? So just a reminder of this vehicle, this policy vehicle that we're in, okay? This vehicle, the organizers are here. We're in the car with the organizers who are driving and helping us get the information out. They're the boots on the ground. They're those grassroots organizations. But we're also engaging businesses because this work takes funding. It takes money in order to make a little noise because we need some gas, okay? Other than that, we also have our legislative key players who are making noise for us before we even hit the ground. So there are already key players that are saying, hey, this is something that we should think about. This is something that we should be pulling our attention to. But most importantly, we have survivors that are giving full visuals, and they are providing real stories that apply to real issues so that we can get real results. So that's real stories from survivors applied to the real issue so that we can get real results. Next slide. The next part of this community mapping and landscape analysis is to know who we're going to talk to. It's the legislative landscape. When you are engaging various of different organizations, various of different backgrounds of victims and survivors, one of the things is that you want to know what you're walking into. I use this analogy a lot, but football players, when a team is getting ready to go up against their opponent, they start looking at the film of that opponent on Monday. So they're already looking at how they play, what their positions are, how they move, what they've been doing before, what they did with the last team, so that they can have an analysis of what particular strategies need to be used when moving policy or educating and bringing awareness about the issues or the different ways that policy can affect victims and survivors. So one of the biggest things that we have to do is to know the data and the demographics of our legislative body. Here in Mississippi, our legislative body, as maybe in most places, is about 60 to 70% white men. And so when we're going into these places, into these legislating bodies, we know that we are creating stories for these men to be able to think about their sisters, their daughters, their sons' friends, their church members, and all of those other particular people. Because it may be a little different to talk to a woman than it is to talk to a man about DV issues. Like that has been one of the things that we know to be true here in our legislative landscape. So the important thing was knowing who represents who in our state. What communities are represented, whether they be unserved, underserved, or inadequately served, and who are the people that are representing those communities. This gives us the opportunity to make sure that we are strategizing when we are sending grassroots organizations and survivors to particular legislators or congressional members to talk about particular topics. We already have in our head what that storytelling should look like. And we'll talk about storytelling as we continue on. The other thing is understanding who your allies are. Legislation and policy, as most of you know, can be very, very tricky because, as anybody would say, it's a political world, okay? So, somebody can say today that they support you, and then tomorrow it may be someone asking them for another favor, and they don't support that particular issue, or they're not able to say that they support that issue. So having a great understanding of who your concrete allies are, that's the people that's not going to change on you, regardless of what the speaker says, regardless of what the chairman says. Those are people that support your issue, they support your cause, and they support what you're doing inside of your community. So know who's in your corner, and always have that list ready, because if you're educating and doing advocacy for policy can switch up. In 1 minute, you may have a piece of legislation coming out of a committee, and then in the next minute, you're like, nope, they're not voting on it today. We need to make calls to our supporters to say, hey, don't forget about these organizations and these survivors that you talked to, that you told us that you support. We need that legislation on the table, okay? Another thing is to think about your opposition. I tell people all the time in Mississippi with the work that we do, I like to know who doesn't like the work, who has, who's not happy with the policy, who has questions, who wants a better education, or who just flat out doesn't want to support. Because my job then, as the person who is navigating these survivors and navigating these grassroots organizations, is to ensure that our opposers are educated, more importantly, about what their opposition does for the constituents in their area, okay? So if you oppose this piece of legislation, this is how it could affect men, women, and children that you serve. These people voted for you, and if you oppose this legislation, this is how that legislation could affect those people who voted for you, okay? Next slide. So when we are done with that particular portion of getting out, okay, we know who we are. We've got our community mapping. We're in our vehicle. We got the landscape analysis. So we're getting ready to pull up to 1010, make that policy work avenue, okay? So this is our visual. But when we get there, what are we doing? What are we saying? What are the strategies? Once you have captured your grassroots organizations and you have captured your survivors to become comfortable with actually telling their story, how do we do that? Our guiding principle for this section is the most powerful person in the world is the storyteller. And that goes back to our survivor. It is no better person to make a vivid picture to legislators, legislating bodies, or even congressional members than a survivor. A person who has actually went through what we are asking them to consider when they're opposing or voting for a particular policy. So this is our form of storytelling and advocacy in a way of education and awareness. Okay? Next slide. So one of the things that I use all the time is life-saving storytelling. Life-saving storytelling is when you tell the story about how a life could have been saved or about how a life was saved based on a particular policy. If we go back and think about advocate confidentiality, which is one of the issues that we've worked on here at the coalition for the past 2 years, we know that advocate confidentiality is a life-saving legislation or life-saving piece of policy. So when we're going to legislators, we're giving them life-saving storytelling that does 3 things. It targets the heart, it channels the ear, and it provokes the hand. So when we're targeting the heart, we're thinking about the impact. And we talked about this a little bit when we were discussing having our survivors as the windows and the mirrors in this vehicle that is moving this policy advocacy. We understand that lawmakers need stories that educate them on the issue, but not just educates them, but it impacts their heart. They're able to look at a particular story that this survivor is saying and see someone that they know, see a constituent in their area, see someone that they're like, wow, I could see this story resonating with my daughter. I could see this story resonating with my church member or my friend. And that is something that hangs on their head to say, maybe I should get a little bit more education about what's actually going on the ground. The next thing we want to do is channel the ear. We want to get their attention. One of the biggest things about having survivors tell stories is the mechanism of teaching survivors how to mature their story. And so this is not saying that your story isn't important, and this is not saying that all of your story isn't important, but it's helping them to understand how to take that story as a victim and change it into a story in survivorhood and to give that to someone in an instant where it automatically clicks and grabs their attention. And the work we're working with legislators and staffers, you have like maybe in Mississippi, we have about 5 minutes because our legislative body is not that big. But when you think about other states that may have larger legislative bodies, you have about 90 seconds. So thinking and having a mature story of survivor, being of this survivor mode and saying that I've made it through, this is how I made it through, and this is why you should consider and be educated on this particular policy, it has to be quick so that you can be very attentive in them understanding and knowing. And I'll be honest, we have legislators that see probably about hundreds of people in a day that come and talk to them and have meetings with them. But the maturity and attentiveness that we desire in our policy advocacy, when having survivors tell their story, is ensuring that it's attentive. It's going to hang. It's going to sit there. Once it gets into their ears, they're going to think about that story for the rest of the day. And then once they have an understanding, their hearts have been targeted, so now they're impacted. Now they can see this happening to a lot of people in their community, in their family, their constituents. But then they also have heard something that what's moving in their heart has now been channeled by their ears. And the next thing is, we got to provoke their hands. We have to give them a call to action to say, you felt that, you heard that, but how can you help us? How can you move this policy? How can you educate your counterparts in this? How can you tell the chairman that we are in need of this particular piece of legislation to have some traction? You have to give them a way to say, let's do this. Give lawmakers a call to action and tell them that we need help and we need it now. And that was one of the great things that we did with our advocate confidentiality law, is that we went in with survivors and shelter directors and shelter programs, and we gave them an understanding of knowing these are your constituents that are being affected, who could also be your family. But one of the important things is you need to hear the story. See how hard it is for a victim to go into a place, into a shelter, and feel like that their story is going to be told to millions of people. Because that's one of the, as a secondary survivor, I'll tell you, that's one of the fears that you have, is that I don't want everybody in my business. But then also having the idea to say, this is how you can help. This is what we need from you. Here is the call to action. Okay, next slide. Now, once you have that idea of how you're going to do it, you have to have particular impactful advocacy strategies. We have in Mississippi, one of the things that people use all the time is calling your legislators or going up to the Capitol or doing those particular things. But one thing that we know is that times are changing and innovation and policy advocacy needs to happen now. And so that looks like providing various of different strategies to help our grassroots organizations and our survivors drive us to 1010, move that policy avenue, okay? So some of the strategies that we've used that have been very impactful is that we do policy listening sessions. We bring those grassroots organizations, those survivors, our shelter program, our service providers, and anyone who has an intersectionality with domestic violence, which we understand and know that intersectionality can be anything. It could be healthcare, childcare. We bring all of those people to the table and we ask them, what policies would make it better for you to serve victims and survivors? We ask survivors, what policy do you think would have been helpful to make it easier for you to get the resources that you needed, to be able to be more comfortable and knowing that someone supported you when you wanted to leave that situation? What can we do to help? And what this does is, a lot of times when as advocates or as people who are driving this particular vehicle, we go into a community or into a particular cause and say, oh, I know what they need. They need this. But ideally, that's not what they need nor what they want. And so policy listening sections give us the opportunity to listen to the actual needs, to listen to the actual policy that people on the ground, these organizations that are serving and providing services, our survivors, our victims, we see what they actually need. And then once we have an understanding of what they need, it gives us a better way to strategize and to go into our particular programming and our advocacy with a strategy. One thing that we do here at the coalition is we do Advocacy Thursdays. And as you can see, advocacy has DV in the inside of it. Ain't that good? I love it. That's my favorite part. So we're saying we're going to come every Thursday. We're going to bring a different organization. We're going to bring a different group of survivors. We're going to bring people from this district, people from that district, this constituent, that constituent, so that there will be a timeline of knowing, oh, they're going to be here. And this was so impactful for us that I would be downstairs in the foyer of the Capitol, waiting on our guests to come, and legislators would walk by and say, hey, Robin, who you bringing with you this Thursday? Hey, Robin, what are we doing today? What's the strategy today? So not only did they know what our issue was, but they knew us. They knew the people that were coming to advocate for the particular issue because there was a strategy. And that strategy was dressing up on purple every Thursday and going into the Capitol and making our voices heard. Next slide. We also did legislative events. And so this is where those businesses come in and they help you to kind of be able to give, to just provide innovative strategies. One of the things that we did is we partnered with Panera Bread because, here in Mississippi, our legislators drive to the Capitol every day because some of them live about an hour and a half away. So they're missing breakfast. Session starts at 8 o'clock. They're having to be here, really early in order to get this work done. And so we needed to show them, hey, we're thinking about you. So we went and we discussed with Panera Bread for them to sponsor coffee. So what happened is that we would have all of our people that were, our supporters, our board members, our survivors in one space, and we would invite the legislators, hey, while you're getting ready to go to session, grab a cup of coffee. So that you can see that these particular people that are asking for you to be educated and aware of what you are doing, to know that, hey, here's a cup of coffee, but we still want to talk to you about how you're going to get this policy done. We also did other particular things that, like socials. We attended socials and other gatherings, because one thing that we understand is the Capitol is not the only place to do advocacy. You can go into, talk with the legislator in the by session and to the off session and tell them, hey, let's have a meeting. Let me bring some people to your office. Let me bring some organizations to your office. Let me introduce you to people that are doing the work so that you can have a better understanding of what this policy means to us and those who are affected by that policy. And then the other thing is educational materials, but not just the paper. Because sometimes I'm gonna tell you, these paper like this will get pushed aside. My first year here, I wanted to print off everything. I was like, okay, well, I'm gonna print this off and I'm gonna take it to them, put it in their hand, da da da. But you have to be innovative. There are thousands of people that are giving them educational material at one time. So some of the different innovations that we've used is, hey, let's put it on a jump drive. Let's get some swag. Let that swag be a jump drive. Give them that particular jump drive and say, hey, if you need any information or data on that particular policy, here's the jump drive with all the information. Or now that QR codes are, really in style, you can give them a business card. They can hover over that QR code and get all the information that they need. And then another thing is a great bomb infographic, something that's colorful, something that they can see. And if it's laying on their desk, they'll be able to say, hey, this came from that organization that wanted me to be reminded about the education and awareness of this particular policy. Those strategies helped us do some really, really great work. And I will be honest and say that it took our survivors, our grassroots organizations, our businesses, our key players, and all those people to help us do the particular work that we accomplished. Next slide. So look at the accomplishment. Where has this gone? We've been in a vehicle. We've driven up to 1010 Make That Policy Move Avenue. We went and told our story. We made sure that everybody knew what was going on. We did the education. We did the awareness. We've engaged our survivors. We've engaged our grassroots organizations. So how do we win? Well, here at the coalition, I've been here since December of 2019. And in 2 years, we've moved 2 pieces of policy. In 2020, that advocate confidentiality piece that we discussed was passed, and we now have a piece of legislation that gives clause to advocate victim protections. So now when victims go and they talk to an advocate about their particular story or issue, they know that it's confidential. It's protected. They don't have to worry about it being, leaked or told to anyone. And there are certain provisions inside of our legislation that helps, keep it away from certain courts, because that is how that issue came to us, because of some, chastisement that was happening inside of the court system. Also, in 2021, just this year, we were able to remove the 25% cash match requirement for shelter programs who receive the Mississippi Domestic Violence Fund. In Mississippi, we don't have a line item for domestic violence. So the only funding that our programs were getting, they were required to give 25% cash match. And thank God, we have had all of these great resources to be provided to us for COVID-19. But if not, just imagine a shelter program having to come up with 25% of about $40,000 to $70,000 during this particular time. So that has now been removed. And all of that happens by engaging survivors and grassroots organizations through the strategies, community mapping, storytelling, and advocacy impact that we have discussed today. So that is all that we have, but I am open to take some wonderful questions if anyone has them.
If you all have any questions, you can unmute yourself and ask your questions verbally so that they can be interpreted and captioned.
So that means that everybody got some real good information and there's no questions and everybody's ready to go and engage survivors and grassroots organizations in policy advocacy, which is really good. I will say that, doing this work in Mississippi is not always the easiest, but it is important that we understand why we should engage our particular, organizations. And so this training or this strategy session is something that we've been doing and we know that it works. And so we are just very excited about the policy work that's happening in Mississippi and the great strides that we're able to do.
Robin, what do you hope to see going forward?
Well, in Mississippi, I would love to see some work as it relates to how we are keeping up with the data of those who are affected by DV and also fatality review. In this work, we know that data is important. Like I said, you can't go into a community or go into wanting to provide a particular service without knowing what the data is. And so we would love to see from the coalition just a form of way to get a consistent approach to keeping the data, getting the numbers, and making sure that we are keeping our victims and survivors allocated for so that we know the trajectory of how it's affecting Mississippi. Another thing that we would like to see is a mandated lethality assessment protocol. We have seen in a lot of different counties here in Mississippi where the lethality assessment program has really helped law enforcement officers be able to provide quick resources to victims in the time of need. So being able to do that on a statewide level, we believe will be able to help the work that we're doing and to get our victims directly in contact with people who are providing that service.
Sarah Owen said she didn't have any questions, but she appreciates this presentation. It gave her some ideas on getting some of their legislation involved. Thank you.
Yes, no problem. And one thing that I'll say is that once you pull on their heartstrings, as I have we talked about, it's easier for them to say, yeah, I need to be involved in that. Yeah, I need to have a conversation about that. I need to talk to my constituents or the particular people that are in my committee about that. So these strategies are very helpful to involving legislators in any of the work. And as we talked about, policy advocacy is not the only form of advocacy. We have systems work that we need to do. We have issues work that we need to do. And all of that involves being able to know the strategy up front and to move into having that landscape provided.
Were there ever times just from doing your work you ever felt discouraged in the work or felt a setback?
Oh yes, the DV match was very discouraging, I would tell you, because when you're wanting to ask a entity to take away a match system that they may believe is being funneled into this fund, because a lot of our legislators did not understand what that funding process looks like. They felt that the 25% match was being able to give us more money into the pot, but it's like, no, that's not what it does. So that piece was really hard for us because a lot of the organizations that we were working with and other people on our team kind of were like, wait, do you really think that we can ask them to remove this? And one thing that we had to do is we had to use those innovative educational strategies. So we started, giving them a visual saying that, hey, you're requiring for these shelter programs to give you 25% match. Well, if a contractor comes in and does work for them, they're not able, say for instance, a contractor saying, hey, we're going to only have you to pay 20% and we're going to donate the other 80% of our work and time to your particular agency. Well, that agency could not use that for match funding because it had to be cash match. And we were looking at this policy in 2020, not knowing, at the beginning of 2020, not knowing that COVID was going to hit and donations were going to be, become very small. And a lot of our organizations were using donations as their way and their means to do cash funding, to do cash match. So that one was a little tough, but we had a very great relationship with a legislator in the House by the name of Representative Angela Cockerham, who worked diligently with us to ensure that we got it passed. And she made sure that it was like a one hit. We did it. She took it through appropriation. She educated her House body. We educated the Senate. And the next thing you know, by a unanimous vote, we were able to give that relief to our shelter programs and service providers. So it was hard, but we did it.
Allison Bernard says, I'm wondering if NRCDV has worked with any local child support agencies, and if so, in what capacity?
So the only work that we have done in my time in here with child support, is it child support or child advocacy?
Local child support agencies.
Okay, so child support agencies. So one thing that we've done here, myself and our executive director, is that we have had conversations with the child support agency that is the portion of DHS that does child support. And one thing that we ensure of is that there's a listing that here in Mississippi. That list can be very long as it relates to actually getting a survivor to the table to have the conversation. So we ended up putting a policy in place, which is a system, because the child support agency, that's a part of a system. And we ended up giving a way so that victims and survivors, if they are a part of our shelter program, we can move them up to the list. We can make sure that they are able to get right into with that Department of Human Services child support area to ensure that they're with their social worker and they can do that particular work. So I don't know if they've done that before these 2 years, but that's the work that we've started to do in this season. That's a really great question, because we have seen legislation that we have been asked about as it relates to prisoners and child support. So that is basically saying if a offender has been sent to prison, there has been legislators who have asked us about our opinions on the need of having a prisoner be on child support or an offender who's in prison be on child support if they are if they're in prison, and what does that look like? And we have, always wanted to ensure that our legislators thought about the different things that a mother or a victim would go through having to care for children in a single household, and how it is still important to ensure that particular funds are given to victims and survivors. Well, thank you all so much for listening to me. This was a very exciting opportunity to come and talk about the work that we're doing here in little old Mississippi. I know that there are probably various of different strategies that can be used in your respective area, but these are the ways that we have engaged survivors and grassroots organizations here, and we are very excited about what that looks like as we continue on in our policy practice.